Was it because the product wasn't ready, or was it because the market wasn't ready for Pear's product?
Yeah, look, we're proud of what Pear tried to do. I think as an idea, digital therapeutics was a really great one. And we were really inspired by what they did. They created great products that had really phenomenal clinical data, and were able to get regulatory approval. But I think the payer market wasn't really there yet to reimburse these things. And so because of that, there were some struggles, and ultimately a restructuring had to happen as a result. But I think as an industry, digital therapeutics has now struggled, but we still hope that eventually there might be bright lights there. Recently there was a big Medicare announcement where they're covering some of these programs now, and so that could potentially be interesting. But ultimately, it's all about bets and timing. And there was a big bet on what Pear was doing in digital therapeutics in general, and I think it was a worthwhile bet to make because I think there was a great opportunity and potential. And I think a lot of that was de-risked, the clinical piece, the regulatory piece, even some of the commercial piece. But not always is everything ready for prime time. And unfortunately, the reimbursement part wasn't. But I think overall, some of them were.